Hello, my name is Dr. Mike Minokian.
And I'm Dr. Dave Minokian, and we want to thank you for joining us on this module.
In this lesson, my brother Dave and I will be talking to you about implementation, and in particular, our experiences with it.
We hope to offer a different, real-life perspective on how to incorporate the things you learn into a practice.
You see, we're general dentists, not specialists, and we see a very wide range of patients. We aren't a small practice either, with just 1 or 2 ops. In reality, we have 11 operatories that we need to keep full in order to stay profitable.
We, like I'm sure most of you, have found ourselves fall into a trap where we continue to educate ourselves, then we get back into our busy practices, and as time passes, we fall right back into our normal, comfortable routines, often not incorporating the things we've learned.
The truth of the matter is, everything we learn at Spear, whether it's on campus, in a study club, or through the digital platform, is meant to be implemented to some capacity.
Problem is, it's easy to sit down and learn things. It's much harder to actually change. The reason we know this is because it was true with us.
In reality, if you're educating yourself but not implementing what you're learning, the only thing you're really doing is being entertained. And while entertainment can be enjoyable, it's often short-lived.
Implementation, on the other hand, can lead to a lifelong feeling of success, enjoyment, and ultimately prosperity.
Our goal with this lesson is to start by covering 6 big obstacles that we face during the implementation process.
Remember, these are our experiences, and yours may be slightly different. In subsequent lessons, we will go into more detail about the specific steps we took and how we incorporated things like the comprehensive exam and clinical photography.
We'll finish it off with a question and answer session.
So let's take a look at the obstacles we faced while changing the direction of our practice. Number 1, our team, or more specifically, the response by our existing team members. Also, how do we get our team to buy into the process? Number 2, dental benefits. Will our patients want comprehensive dentistry, or do they only simply want to do what insurance pays for? See, our practice is mainly fee-for-service. However, we do participate with a small selection of insurance companies. We will share our experiences with this and our decision process when it comes to patients' benefits in general. Number 3, the time and cost of implementation. We will discuss the resources we invested in and the need for setting aside time to train the team and get everyone on the same page. And when it comes to our initial comprehensive exam, we will discuss why we don't view it as a profit center, but rather the center for all of our future profits. Number 4, talking about money. A conversation that probably a lot of us don't like to have, but we will discuss systems that we've put in place to help make the team more comfortable talking about the financial side of dentistry. Number 5, our belief system, or more specifically, a lack of confidence or scared of the patient's response. Is confidence something that's holding us back from telling patients everything we see during our initial exam? Is confidence an issue when it comes to our team? And how will our patients respond to what we recommend? Will they perceive high value from our comprehensive approach, and will they change the way they view their overall oral health? Number 6, being worried about delivering. Can we exceed the patient's expectations? And are we competent enough to perform comprehensive dentistry and give patients the results they're looking for? Again, we know that for your practice, it's most likely going to look a little different than our specific examples. But we know after talking to numerous doctors, these seem to be a common theme in a lot of practices. Our goal is to share our experiences, and our hope is that you'll be able to take what applies to you, learn from our mistakes, and use it to grow your own practice. The first obstacle, our team. For us in particular, resistance from the established team members in the practice was something that stared us in the face from day one. See, we have a pretty big team, about 25 people, and a majority have been with us for at least 10 years. This was a big barrier for us, and in reality, change can usually be a scary thing, particularly for team members that were used to a certain flow of the practice for so long. For us, it was important that before we made this commitment to move our practice in a new direction, we had to be confident we were doing the right thing. These are people we spend a lot of our life with, so we wanted them to feel our confidence and know we were leading them down the right path. One thing to keep in mind is that change doesn't have to occur all at once, and it sure didn't occur all at once for us. Over time, we believe this made it easier for the team to adapt. Again, we have 25 team members, so we had to find the easiest way for everyone to transition without feeling frustrated. We felt if we made too many changes at once, we would lose some of the team members and start to create disbelief. That being said, it's still an ever-evolving process for us and the team. One of the hardest things about learning new concepts in dentistry is that there are very few things you can implement easily. And as with most things, anything worth having requires work to achieve. We put ourselves up to the challenge because this is the direction we wanted to take our practice. So before we get into any more details, let's back up for a second so Mike can give you a little bit more background about us and where this all started.
So, to be totally honest, my brother and I were lucky. We went to private practice with our father right out of dental school. We didn't have to start from scratch or revitalize a struggling practice. Our father had developed an office that has a strong reputation for doing high-quality dentistry and delivering a consistent and a sought-after brand. The easy thing would have been for us to continue down the already established path. Well, we didn't choose the easy way. Yes, we carry along many of the systems and the philosophies that help make his practice great. However, we wanted to stay ahead of the curve. And you can't really stay ahead of the curve if you don't adapt and continue moving forward. You know, growing up, our late grandfather was the type of role model that would always give us good life advice, but typically way before we were ready to hear it. One thing he'd always tell us while we were riding in the back of his old Oldsmobile was that if we ever decided to one day join our dad in practice, we couldn't be content with the status quo. He'd go on to say that our dad had the challenge of starting a practice, we'd have the challenge of bringing it to a whole new level. It was advice that we still hold so true today. Stay the same and get passed by, or evolve, grow, and reap the rewards. Right out of school, our father was adamant that my brother and I attend Dr. Spear's seminars. At the time, we were attending all the hotel lectures. One day, we finally made the jump to take the facially generated treatment planning workshop, and at the time it was held in Seattle. To be honest, we were young, and it was a big and scary decision. We knew that it was a good amount of money, and we just didn't know if we'd see the return on our investment. I remember we even called our accountant from down in Florida, where we were attending the occlusion seminar, to see if we could afford it. In hindsight, it was the best decision we ever made. It was all because we made a choice that we weren't going to take it as just this amazing education experience. We took it as a challenge to implement our learnings in an already well-respected practice. Our father and the longtime team members, they showed some initial resistance to our implementation ideas. You know, the rolling of the eyes and the doubting, it was all in full effect. I can hear it now. Frank Spear can do that type of dentistry because he's Frank Spear. Well, honestly, we didn't buy it. We didn't think that excellent comprehensive dentistry is exclusive to certain zip codes. But we still sensed from the team, why fix what's not broken? We decided that this was a serious enough topic that we needed to block out an entire day for a team meeting. You know, our accountant always tells us, sometimes you need to work on the business instead of in the business, meaning sometimes you need to step out from the operatory and take a global view of the practice. At our all-day team meeting, we took that opportunity to lay out our vision. We also used that time to openly recognize the success that the practice has had over the years. However, we stressed that staying the same wouldn't continue to separate us from the pack. We also made a decision that we weren't going to bite off more than we could chew and implement 1,000 things at once. Instead, the first thing we decided to implement was the new patient comprehensive exam. Why? Because in reality, it's an easy thing to change. New patients, they don't know any different. For all they know, we've been doing a comprehensive exam for years and years. And as we mentioned before, it was also easier on the team because they could focus on one area of change instead of feeling flooded with too many ideas.
We decided that in order to effectively implement the exam, we needed to spend more time with our new patients. Years ago, we would simply bring a new patient through hygiene, then do a 5 to 10 minute exam afterwards. Well, we felt like this just didn't cut it. 5 to 10 minutes between patients just wasn't enough time for us to have in-depth conversations with new patients. Were we really giving the new patient an experience that was different from any other office? And were we really setting ourselves apart? See, we believe that more time spent with our patients helps to raise the patient's perceived value of dentistry and our practice. Raising perceived value lets us talk about things in their mouth that they may have never heard before. And some may think that this type of experience could scare people away, but we've actually found it to be a much more positive experience and one that most patients really appreciate. In reality, this is how most startup practices initially grow. Dentists typically has more time than they do patients, and as a result, they spend a lot of time with those patients. This usually results in the patients having a better experience, more often than not accepting more dentistry, and referring more friends and family to the practice. In our office, we prefer that the comprehensive exam not be a choice for the patient. This is the direction we want the new patient to go because we believe it's the best approach to the patient's long-term oral health. We had found that if we leave it up to the front to make the decision of who needs it and who doesn't, more often than not, patients would not receive the exam because in reality, it's easier to give in to the patient's requests than to take control and explain the importance of why we are doing what we are doing. It's our belief that from a patient's perspective, they don't know what they don't know. I mean, how many times does a patient think they have no problems at all, only for you to do an exam and find a whole mouthful of needs? So one of the major steps we took was setting up new rules and boundaries for new patients over the phone. In the beginning, a lot of people, including our dad, said that this just wouldn't work. Well, we didn't agree. So we said to ourselves and the team, let's track patient responses very closely over the first 90 days and see how it's going. Well, we still currently track it, and now, 5 years later, we wonder why we did it any other way. So even though we're a small sample size, it's something that's worked for us. And keep in mind, your systems may look a little different, but the important thing is to have everyone on the same page and create consistency throughout the practice. In a future lesson, we'll get into the specifics of the actual exam and all of the boundaries that we've set up around it. We're a large family practice, and it wouldn't be realistic to bring children in for a 50-minute comprehensive exam, so we made guidelines for our team to follow to help filter patients down the appropriate path. So honestly, when it came to our initial hurdle of getting the team on board, our fear of resistance didn't necessarily match reality. Once we had our all-day meeting and laid out our vision for our ideal type of practice, and once they got to witness the new patient's response, everyone jumped on board. This simple yet powerful change in the practice not only gave our patients a different view of dentistry, it also started to change the outlook of the team members. They started asking more questions, becoming more engaged, and excited about dentistry again. They felt this was how they would have wanted to be treated if they were a new patient, and really began to see the value in the overall health it was providing the practice and the patients. Yes, it was a different experience and a different way to do things, but that's what helped set us apart and take our practice in the direction we wanted to go. In the next module, Mike is going to introduce the second barrier on our list, which is dental benefits. This is probably a common topic for many of you and something that you may think could hold you back from doing the type of dentistry you really want to do. Again, this is another process that is constantly evolving in our practice. Thanks for joining us on this module, and we hope you join us for the next lesson.